Good. Hello everyone, we're going to talk about dentophobia. First we'll talk about what dentophobia is and what causes it. In simple terms, dentophobia is the fear of dentists. And normally patients are a bit nervous when coming to the dentist. But dentophobia is much more severe. It can be classed as a huge feeling of dread before every appointment. Dentophobia can be associated with a variety of factors, such as specific procedures, the feeling of sitting in the dental chair, in the waiting room, or even specific instruments or certain smells. 53% of people in the UK experience some sort of fear related to the dentist, with 25% of people suffering from dentophobia. 17% of these people suffer with a level of dentophobia so high that they completely avoid the dentist. Dentophobia is a huge problem because it can mean patients don't come to their appointments, and then conditions that they have can get worse or go undiagnosed. Dentophobia is usually caused by patients having a bad dental hygiene. This can make them feel guilty, which can manifest itself as fear. However, there are also other phobias that can lead to dentophobia, such as the ones on the board. Emetophobia, the fear of vomiting, is one of the most relevant to dentistry, as during appointments, patients usually have to keep their mouths open for long periods of time.
Hang on, wait. Okay.
Not only is bad dental hygiene and phobias a cause of dentophobia, but genetics can also affect it. Medical professionals agree that dentophobia can be genetically predisposed. Overall, it's a combination of all these factors that can lead to someone having dentophobia.
So some symptoms of dentophobia are heart racing, elevated blood pressure, rapid breathing, trembling and tremor, and much more. Ways to manage dental anxiety is deep breathing, meditation, talking to your dentist about how you're feeling, distractions, and guided medication. Exposure therapy is also one of the main treatments. If the dentophobia is much worse, then a psychological approach needs to be used. During exposure therapy, a mental health professional exposes you to situations and images that may trigger your symptoms. This exposure happens in a controlled setting where you can work through your responses. As you manage your fear more and experience it much more, over time it will get better. Most people also see their symptoms improve after getting a type of psychotherapy, which is just repeatedly talking about how you're feeling. During exposure therapy, you learn breathing and muscle relaxation techniques to use before and after an exposure, so that when you visit the dentist, you'll learn how to use these techniques and hopefully it'll calm you down. You also view images or videos of people visiting the dentist, so you get much more used to it and overcome the fear. Gradually progress to visiting a dentist's office without treatment, and then having a cleaning or simple checkup with the hygienist or dentist. If the case is really severe, pharmacological interventions can be used, such as happy gas, tablets, conscious sedation, and general anesthesia. It is important as a dentist to be able to deal with many different types of people, such as people with dentophobia. Their needs should be prioritized, and making them as comfortable as possible is also a key role of a dentist. This can help prevent people that have bad dental hygiene, and talking about it and educating people is a key role. Key skills needed are being compassionate, empathetic, and understanding, and being a good listener. What else can dentists do to help? Talking to the patient and understanding what sort of treatment they may need, such as if they want to use any sedation methods or simply not using a specific tool. You can also use different incentives, such as sweets, stickers, and even dental hygiene to get them more excited and comfortable with using dental hygiene equipment. You can also distract them and make them feel more comfortable by using jokes, so they don't pay attention and feel less nervous. And overall, being understanding of their situation and that this can be really hard and nervous for them, so not being too forceful if they require urgent treatment. Thank you for listening.